Myasthenia gravis is an interesting condition. Myasthenia gravis is a autoimmune disorder. And for those of you who don't know what it is, it's a disorder where the muscles lose the ability to do their work and they fatigue over time. And there are medications that help with that condition, and there are different degrees of severity. There are people who get out of bed in the morning and within an hour they have to go lay back down again because their muscles have lost all energy, lost the ability to do any work. On a milder level, people with myasthenia have droopy eyelids. So as the day goes on, their eyes can't stay open. Most people don't realize this, but actually it takes more energy to relax a muscle than it does to have a muscle contract. So our body's always contracting and relaxing constantly. All the muscles in the body are going through that process. And when the brakes are taken off, the relaxation part of it, the muscle contracts and goes into spasm. And you see that problem in cerebral palsy, you see that in multiple sclerosis and other neurodegenerative disorders, brain injuries, and so on. So myasthenia has the opposite problem. Myasthenia has the problem of the muscles becoming too relaxed. They can't do their job. So you can have the eyelids having that problem. You can have problems with breathing. The more severe forms of myasthenia can have a problem with breathing. You can have muscle, again, relaxation where you can't basically barely move yourself. So being an autoimmune disorder, it needs to be treated like an autoimmune disorder. And again, there's several interviews that talk about people who have had autoimmune issues, and one in particular that deals specifically with autoimmune. But magnetic field therapy may help to reduce the inflammation that can be associated with the myasthenia when there is inflammation associated with it, depending on how bad it is. Number one. Number two, it actually provides energy to the muscle to be able to work harder. We've seen this with muscular dystrophies. Similar kind of issue with muscular dystrophy. The muscles just don't have the energy to do the work they need to do to hold the person up. And so magnetic field therapy, whole body in particular, applied to these situations, to these individuals with these problems, helps those muscles work better. But again, you might need to go low and slow with intensity and treatment time, especially in the more severe forms of myasthenia.